Eye care is the care and treatment of the eyes as well as eye disorders and vision. Eye care coverage reimburses the injured for the cost of eye tests and contact lenses. The goal of comprehensive eye care is to provide people with access to eye care services that meet their needs at every stage of life. This includes programs such as vision restoration as well as prevention and treatment. Comprehensive eye treatment also helps to treat the whole range of eye diseases. Eye care is performed for a variety of purposes, including cleaning the eye of discharge and crust prior to the application of eye drops, soothing eye inflammation, and preventing corneal injury. The value of eye care is that your eyesight is one of the most critical senses because it accounts for 80% of what we experience. By shielding our eyes, we will reduce our chances of blindness and vision loss while still keeping ahead of any emerging eye disorders like cataracts and glaucoma. Thank you.
Next is causes of eye problems. First, eye strains. It happens when you overuse your eyes. This is because people read for hours, work at a computer, or drive a long distance. Second, red eyes. This is because the surface of eyes is covered in blood vessels that expand when they are irritated or infected. Next, night blindness. It is a symptom which develops from a degenerative disease involving the retina that usually cannot be treated.
Next is causes of eye problem. Okay, color blindness. It happens when you cannot see certain colors. If it is more severe, people can only see in shades of gray. Okay, next is presbyopia. This happens when you lose the ability to see clearly close objects and small frame. Okay, lastly is dry eyes. This happens when your eyes cannot make enough good quality tears. It feels like something is in the eye. Extreme dryness can lead to some loss of vision.
Hi sir, so in this slide I'm going to explain about the treatment of eye disorders. The first one is we should eat supplement. Supplement of eye got combinations of vitamin C and E, lutein, copper and zinc. The function of vitamin C and E in the supplement act as the antioxidants and able to prevent cataracts and reduce the risk of age-related macular degeneration. And the second step for the treatment of eye disorders are wearing an eyeglasses. According to the dictionary, eyeglasses is a single lens for correcting or assisting defective eyesight, especially a monocle. So the lens for eyeglasses will be decided based on each patient's prescription. Thank you.
I would like to explain about steps to maintain our eyes care. The first one is we need to eat a healthy and balanced diet, which is our diet should include plenty of fruit and vegetable, especially yellow leaf and green leaf vegetable, such as carrots. We also know that carrots are rich in vitamin A, and also we need to eating fish high in omega-3 fatty acid, such as salmon, tuna, and halibuts. Next, we need to maintain a healthy weight, which is being overweight or having obesity increase your risk of developing diabetes. Having diabetes put you at the higher risk of getting diabetic. The last one is we need to give our eyes rest. This is because if we spend a lot of time using computer or handphones, or we spend a lot of time playing computer games and more, we can forget to blink our eyes. Then the effect that our eyes can get tired. To reduce the eye strain, there are some tips that I can provide, which is we can try the 20-20 rules, which is every 20 minutes, look away about 20 feet in front of our for 20 seconds. Thank you.
Okay, next, how to prevent common eye problems. There are many modifiable lifestyle factors that contribute to sight loss, and pharmacies should be able to advise patients on how to reduce their risk. Okay, so for the first, how to prevent common eye problems. First, reduce alcohol consumption. Okay. Heavy alcohol consumption has also been associated with known causes of blindness, including age-related macular degeneration, AMD, when the cells in the central part of the retina become damaged and central vision is impacted as a result. So, a meta-analysis of 5 published studies found that heavy alcohol consumption, defined as an intake of 30 grams of alcohol per day, was associated with an increased risk of early AMD. Alcohol is thought to increase oxidative stress by modifying the mechanisms that protect against it, resulting in AMD. The link with cataracts, clouding of the lens in the eye, is less clear, but an increased prevalence of cataracts has been reported in patients with heavy alcohol consumption. So, for the second, quit smoking. A history of cigarette smoking has been associated with an increased risk of AMD and is related to both its incidence and progression. Current smokers have been shown to be an increased risk of developing AMD compared with ex-smokers and non-smokers who are exposed to second-hand smoke. Cigarette smoke has also been shown to have a dose-related relationship with the formation of cataracts. It has also been linked to diabetic retinopathy. The blockage of blood vessels at the back of the eye, that and glaucoma, a condition affecting the optic nerve. A cross-sectional survey of 216 teenagers found that fear of blindness was just as compelling a motivation for smoking cessation as fear of lung cancer, heart disease, and stroke. Discussions relating to the eye care could therefore help motivate patients to quit smoking. Pharmacists and healthcare professionals should inquire on the smoking status of all patients at least once per year and should discuss it during routine consultations. They can even provide advice to patients outside of smoking cessation services or the provision of nicotine replacement therapy, including during the purchase of over-the-counter medicines, through medicines use reviews, or during local or. So, third, protect eyes from the sun. High levels of exposure to ultraviolet A and B light are known risk factor for numerous eye conditions, including cataracts and cancer. Most brands of prescription glasses now contain a UV filter, but not all sunglasses provide adequate protection. Patients should be counseled to ensure their sunglasses are either CE or BS mark, proof of conformity with European or British standards respectively, and are the appropriate filter category for their use. That's all. Last but not least, reduce screen time. Increasing reliance on digital devices has led to a rapid increase in computer-related eye symptoms, known as computer vision syndrome. Symptoms of CVS can be divided into 4 categories. First, eye strain, asthenopia. Second, dry or painful eyes relating to the ocular surface. Third, difficulty focusing, visual blur. Fourth, other non-ocular symptoms. For patients experiencing CVS, a range of pharmacy medicines are available over the counter, along with environmental management options such as for symptoms of fatigue. Everyone using screens should be advised to follow the 20-20-20 rule. Every 20 minutes, individuals take a 20-second break and focus on an object 20 feet away. Modify the screen environment, taking into account lighting and glare, airflow, screen and seating configuration, and blue light. So, that's all for me. Thank you.
In conclusion, as we know, eyes are an important part of our health. Most people rely on their eyes to see and make sense of the world around them. But some eye disease can lead to vision loss. So it is important to identify and treat eye disease as early as possible. We should get eyes checked as often as your healthcare provider recommend it, or if you have any new vision problem. And just as it is important to keep your body healthy, you also need to keep your eyes healthy.